We designed the space for how we wanted it.
This is San Diego County's new $93 million public health lab in Kearny Mesa. At 52,000 square feet, it's nearly 3 times larger than the old lab in Point Loma.
And this is what we use to actually identify bacteria.
The bigger space means they can do more testing of samples, and more testing means quicker results and faster treatment. Jeremy Corrigan is the San Diego County Public Health Lab Director.
In the past, we might have had to send samples out to CDPH or CDC and rely on a weeks to months turnaround time for those results.
Now, he says, the turnaround time is days. New at this lab is genomic sequencing.
It's an early warning system.
Genomic sequencing lets researchers identify a pathogen's unique genetic markers to determine where a disease outbreak came from or if there are multiple outbreaks.
To diagnose patients quicker, to prevent the spread of outbreaks and diseases.
The new facility is also a biosafety level 3 lab.
This is where we do measles, mumps, hepatitis.
Which means it can test for lethal pathogens such as anthrax and ricin. But most importantly, this facility allows the county some independence from the Centers for Disease Control and Prevention. Because, Corrigan says, public health is local first.
We are in control of what our priorities are. And so this is why I'm able to stand up and bring up any kind of testing that our community needs, and I don't have to go through other permissions to do so.
In March, the Trump administration rescinded funding for the lab just as it was nearly complete. Corrigan says the federal funding was restored and the lab was completed in time for today's opening. Alexander Nguyen, KPBS News.